He said, men and women ought to always pray and not give up, and keep on praying, keep on asking, keep on believing, keep on petitioning. Ask and it shall be given. Seek and ye will find. Knock and the door will be open. Well, it's good to see you here tonight, those of you who are here and those of you who are looking in on us through online services. Just want to remind you, those who are not able to get here and if we're not here on Sunday, we will be here on Sunday again doing this virtually, and we pray that you will be praying for us. If you are a member of this fellowship, and you don't have to be a member, but if you feel that you ought to respond by giving, you would do that online through Giblify, the First Cathedral, and through Cash App, the First Cathedral 1. And then if you want to text to give, take down this number, 833-766-8657. Remember that people who are under the age of 18 will still have access to free bag breakfast and lunch meals. The pickups are Monday through Friday from 8 a.m. to 9 and from noon to 1 at Common Erase Middle School, 390 Park Avenue. And you'll have to leave your car briefly to pick up those meals. Volunteers are still needed. We pray you will volunteer to help those who are distributing foods in different locations, such as food shares, and also through our schools. We appreciate that. Tonight, as we are here, we're remembering as we go through the coronavirus that we're not in it of ourselves, that we have these wonderful physicians who are with us tonight. And let me introduce them now. Dr. Alleyne from the Eastern Orthopedics, Dr. Rochelle Collins, who is the general practitioner at Living Well Primary Care, and Dr. Kevin Collins, Pro-Health Family Practitioner. We are thankful for them. But I want to leave you with a word before we turn it over to them and allow them to speak to us, because they are concerned about the well-being of our people in Greater Hartford and here in the Bloomfield area. Listen to what the Apostle Paul says to us who are believers, who have given our lives over to the care of the great physician. Here's what he says in Ephesians 6, beginning with the 10th verse. Finally, when you've done everything else you can do, finally be strong in the Lord and in his mighty power. You know, we have some power, but we don't have almighty power. We have some strength, but it is vague. But God has all power. Put on the full armor of God so that you can take your stand against the devil's schemes. For our struggle is not against flesh and blood, but against the rulers, against the authorities, against the powers of this dark world, and against the spiritual forces of evil in the heavenly realms. You know, we don't know where corona has come from, whether it came from China. That's not the issue. It had to be developed in a cruel and vindictive mind, we believe, from the spirit realm, from the evil one himself. Therefore, put on the full armor of God so that when the day of evil comes, you may be able to stand your ground. And after you've done everything to stand, stand firm then, with a belt of truth buckled around your waist, with the breastplate of righteousness in place, with your feet fitted with the readiness that comes from the gospel of peace. In addition to all this, take up the shield of faith with which you can extinguish all the flaming arrows of the evil one. Take the helmet of salvation and the sword of the Spirit, which is the word of God. And he concludes by saying, pray, keep on praying, and let your requests be known unto the Father. In times like these, I'm glad you're being able to get some rest, to spend some time with your family members and with your children, a time for rehabilitating your own strength. But remember, when you're not able to resolve all of the problems that you're facing, there is God. And God is yet a very present help in the time of trouble. I remind you on what I said Sunday, and I'll keep on reminding you. If my people who are called by my name will humble themselves and pray and seek my face and turn from their wicked ways, then will I hear from heaven, forgive their sins, and heal their lands. Thank God for these physicians who are here tonight. Let them tell you a little bit more about themselves and why they are here. Dr.
Thank you, Archbishop.
Yes, sir.
Good evening. My name is Dr. Ken Alleyne. I'm an orthopedic surgeon at Eastern Orthopedics and Sports Medicine here in Bloomfield, South Windsor, Tolland, and Manhattan, although I don't go to Manhattan anymore over the last 3 weeks. It's a little different down there than here, thankfully. We'd like to thank you for having us here, Archbishop, to share with you a little information, hopefully to add to the information that you have. People have been inundated with a lot. Some of it's good, some of it's bad. Don't believe everything you read on Facebook or Instagram or Snapfish or whatever else that you may get your information. We're going to be here to really try to talk about the facts as we know them, the facts as they exist today. Not theory, not conjecture, not things that people with yellow hair might discuss, but what are the facts? We're going to divide up today in sections. I'm going to talk a little bit about prevention. My wonderful colleagues, Doctors Kevin and Rochelle Collins, will talk about risk, how to protect yourself, treatment, what quarantine means, and what signs and symptoms to look for. I've written down some things, so I'm going to make sure that I refer to my notes because I don't want to miss anything, because all of this is really important. And all the jokes aside, this is a very serious disease. Number one in prevention, which you've all heard, is hand washing, right? That hand washing has to happen with soap. That hand washing has to happen for at least 20 seconds. Do not assume that all in your home know how to wash their hands. I have a 14 and a 16-year-old. I had to watch them. I don't know if you guys experienced this, but I had to watch them wash their hands because I assumed they knew how to do it properly. But 20 seconds with soap under hot water. The virus does not like hot water, the virus doesn't like soap, and the virus does not like vigorous scrubbing. So hand washing for 20 seconds. When you are out and about, I think I still have mine with me, I had it earlier, hand sanitizer, right? You should always have that with you, in your vehicle, in your purse, in your pocket, on your person, because you are touching things all the time. Now, particularly now where hand sanitizer can be difficult to get, two things. A lot of the stuff that you see online is bogus, so be careful on what you order. It has to have at least 60% alcohol in it. So try to read the label, okay? There are a lot of hand sanitizers out there with 30 and 40%. That's not good for this. It has to have at least 60% alcohol in it. If you can't find it, easy enough to make, rubbing alcohol or ethanol, 2/3 with 1/3 something like an aloe gel. 2/3, 1/3, put it in a bottle, you have your own hand sanitizer, and that will come out between 66 and 70%. So you can make your own hand sanitizer, and there are lots of videos online and YouTube as to how to do that. But 60%, have it with you.
Let me interrupt you just for a second.
Sure.
I apologize. One thing I forgot to say, if you are online, if you have questions you'd like to pose to the doctor, doctors, do so by Facebook or by calling the church here. There are people online, 860-243-6520, 860-243-6520, and they will present your questions to the doctor. Continue, doctor.
Thank you. So that's 60% alcohol in your hand sanitizers, okay? Important. Obviously, human beings cough. Everyone that coughs around you does not have the coronavirus. You don't have to shun them. You don't have to hit them. You don't have to throw them off the bus like happened somewhere, I think in San Diego, because the guy was coughing. People cough, okay? But if you're coughing, cough responsibly, and that's coughing into a handkerchief, a napkin, or your elbow, right? So be aware of your cough, how you're coughing, because clearly if you are infected, that's an opportunity to expose others. But realize that people do cough. Cleaning surfaces. So again, this is all about prevention, right? So there's cleaning surfaces and there's disinfecting a surface. Those are two different things. If you take some dishwashing liquid and you wipe down the sink or wipe down the counter, that's cleaning the surface. Cleaning the surface, we can reduce the number of germs because we're taking away dirt, but we're not killing the germs. Now, reducing the germs is helpful when all else clean. Disinfecting is using a disinfectant. That's using Lysol. It's using Clorox wipes. It's using the various other sorts of disinfectants that are out there, and that kills the germs. Your goal should be to disinfect all the surfaces in the home that people come in contact with. And don't assume and don't overlook even the small surfaces, light switches, obviously door handles, knobs, remote controls. Those things need to be disinfected because this virus, we know, can live for up to 24 hours on some surfaces, okay? Stay as healthy as possible in terms of not only your attitude, your immune system gets depressed with stress, right? Your immune system, and that's not a guess, that's real. Your immune system can get depressed with stress. So you want to have a healthy attitude as much as possible. I tell my patients, turn the television off. It's not going to change in an hour, I assure you. The virus will still be here 2 hours later, okay? Disconnect, and that means even disconnecting from the Netflix. I know everyone's got more on-demand and Netflix going now than probably in any time in their lives, but sometimes you want to disconnect from the screen. Go outside and take a walk. Fresh air is good. My family, we like to drive, so we'll get in the car and we'll take a drive somewhere. Ride a bike, work out, listen to music, but try to disconnect and reduce the stress because the stress can lower your immunity. During this time, a good diet's important. If you have access to them, fresh fruit and vegetables, canned fruit and vegetables, but try to make sure you keep that diet up because that diet supports your overall health, and you need your overall health to be maximal in order to fight this virus should you become infected. Try to stay away, and now this is prevention, but preventing it in others. We want to try to stay away from the folks who are at the most vulnerable in our community, okay? Now, as someone who is in his 50s, someone saying that 60 is a senior is a problem for me, but for this diagnosis, 60 is the cutoff that we're saying where people have a higher risk of contracting and being sick, significantly ill from the coronavirus. So in particular, you want to try to stay away as much as possible with the young people from the seniors in our community. My parents are on lockdown in their home, okay? My two parents. My mom is 79. I'm blessed to have a dad who's 89, and they are in their home. I've seen them about 5 times through the door, through the front glass door, and on FaceTime. I deliver things to them and leave them on the front stoop because there's a risk to that population. And so you want to be very mindful. One of the challenges now is that because schools are out, you have a lot of kids and college students who may be home living with grandparents. Multiple generations often live together. You just have to really be mindful of the proximity that you have to the seniors and making sure in particular that the things that they're going to be around and touch are being especially focused on in terms of cleaning and, if possible, to separate those out. Practice social distance, right? We hear about social distance. Do we know what social distance is? Social distance generally is 6 feet. Why 6 feet? That is the distance generally if someone coughs or sneezes that those droplets can travel. So that's why we call it social distance 6 feet. And if you don't believe it, someone really has studied how far a sneeze can go. And 6 feet, apparently, you're outside the zone. Avoid touching your face, in particular your eyes, your nose, and your mouth. If you have to, use the back of your hand, use your sleeve, because the virus exists on your hands. And there may be a time in between the time when you've washed your hands or sanitized your hands that you touch your eyes, face, or mouth. And the eyes are vulnerable as well. A lot of people don't realize that. So try to avoid as much as possible touching your eyes, face, or mouth. Other little things that have been found to be helpful: hot beverages. The virus generally attaches to the back of the throat, and that's where it replicates. So hot beverages, hot tea, hot coffee, hot water. It doesn't have to be tea or coffee, but hot beverages will help to kill the virus and wash it away from the back of the throat. Once it gets into the stomach, it is neutralized. Okay, so hot beverages, and the recommendation is several times a day with a hot beverage. For me, that was Starbucks, but Starbucks is now closed, so I'm suffering now, but I have put a coffee maker in my office so I can have my hot beverages. Other things, people talk about vitamins and that sort of thing. Obviously, being healthy is important. Taking vitamins is important. I think Dr. Collins will probably talk a little bit about that. There has been a role for zinc-containing lozenges in this. The zinc helps to decrease the ability of the virus to replicate. Not necessarily specifically this virus, but has been studied on other coronaviruses. So the CDC has made recommendations that it may work for this virus as well. So those are kind of my points, largely on prevention. There may have been some things that I've missed, and we'll be happy to answer those questions. We'll go ahead with Dr. Collins, who will talk about what to look for in symptoms and when to seek treatment.
Dr. Rochelle Collins, and I have a primary care practice in Bloomfield. It's called Living Well Primary Care. I've been in practice for about 10 years. So that's a little bit about me. This is definitely challenging times for everyone. I think as far as the timing, it makes it even more challenging because this is the time where we're dealing with, influenza season, and we're also dealing with seasonal allergy season. So when you talk about, patients who are coughing or sneezing and things like that, everyone's getting dirty looks. But we're also dealing with, like I said, flu and seasonal allergies during this time. So as you can see, we're starting to get some of the blooms in the trees, and well, not from yesterday with the snow, but like I said, as far as seasonal allergies, we're dealing with that as well. So coughing, sneezing is not all coronavirus. There's been a lot of vulnerability, as Dr. Alleyne mentioned, with our older population. And so some of the symptoms related to COVID-19 are influenza-like symptoms. So the symptoms can range from mild disease or mild symptoms to severe, which requires emergency visits or more urgent care. Some of the milder symptoms typical of influenza can be starting with sneezing, coughing, nasal congestion. Nasal congestion is not typical, but you can start off with a little bit of sneeze in the beginning. Body aches, and obviously a big thing is fever. So some people can actually have the virus and transmit the virus even before they have symptoms. So you have that incubation time between 2 and 14 days, which is where that 14 days of social isolation comes from, especially for people who have been diagnosed with the COVID-19 virus. So, symptoms, again, muscle aches, body aches, fever, which can sort of vary by person. A lot of the younger patients population are getting more milder symptoms as opposed to the older population. We're also dealing with patients who have a lot of concerns and a lot of panic behind the COVID-19. So being, mindful of what your symptoms are and, where you've been, where your travel is, who you've been exposed to, and have you been isolating overall. If you do find that your symptoms are worsening and you feel that your fever or you're getting short of breath or, chest pain or anything like that, then that probably requires a visit or a call to your primary care provider, just to sort of get some guidance on, where you go from there. As far as testing for COVID-19, I think that's one of the biggest challenges that we're having in the United States is that there's not enough testing, there's not enough kits. Even primary care providers can't necessarily write a prescription, for someone to go and get tested. So we're dealing with that challenge where a lot of patients may have the virus and can't get tested. And right now, as far as the guidelines, anyone over 60 with a fever or a healthcare provider over 60, someone who works in the hospitals, things like that, you cannot get tested unless you're over 60 years old. So being mindful of your symptoms, being mindful of your environment and where you are is definitely a challenge. And like Dr. Alleyne also said, taking care of yourself. Just like you would take care of universal precautions as far as influenza virus, you want to make sure that you're washing your hands. You want to make sure you're getting enough sleep. You want to make sure that you're hydrating. There's so many things available out there as far as mental health. A lot of virtual meditation and things like that are happening as well now. So taking care of yourself, I think, is a big key in how you deal with symptoms at this point.
Thank you. Dr. Collins, talk a little bit about quarantine and what is isolation.
My name is Dr. Kevin Collins. I'm one of the pro-health physicians. I have an office in Hartford and West Hartford, and we've been here almost 17 years. So in case you guys didn't know, this is my wife. So my better half. All right. So as far as the quarantine, so the CDC is recommending that that's a period of pretty much isolation for 14 days, all right? So the 14 days come from some of the studies of one of the other novel viruses like coronavirus. So because they don't have enough information specifically for coronavirus, but the 14 days is about the incubation period where patients would exhibit symptoms and things like that. So just today I had a case of someone has been exposed to someone that's tested positive for the coronavirus. So naturally it was about 10 calls to the office on what to do, despite my staff telling them what I told them to tell them of what to do. So it's pretty much isolation. He's asymptomatic. And so, as Dr. Collins mentioned, you want to pay attention to your symptoms, all right? Having a fever, having body aches, a cough, sneezing, things like that. So that makes our job so much more difficult because it overlaps with so many other different things. So if you don't know, that's why you have to contact your primary care provider and get some direction on where to go. As Dr. Alleyne mentioned, all the information on the internet is not accurate. So your trusted primary care provider is the resource that you should be using. Also, there are a lot of 1-800 numbers. Hartford Hospital has one, ProHealth has one, the CDC has one. They're all over the place. So I would definitely, if you have any questions, just contact your primary care provider and let them guide you which way, But as far as the quarantine, so that's 14 days. That's meaning ideally being in your own environment. For older people, it would be, like Dr. Alleyne's parents, they're inside. If you have roommates, ideally it would be recommended to stay in your bedroom. All right. You can still have roommates, but if you have roommates, you shouldn't be sharing dishes and things like that. If you're using universal precautions for coughing, Cover your mouth. If you cough into a napkin or something, you want to discard that, you know. So those are the basic things as far as quarantining, using universal precautions. But if you ever have any questions, call your primary care provider.
Thank you, Dr. Collins. And I should note that Dr. Rochelle and Dr. Kevin Collins are two of the most outstanding primary care physicians in this community. It's your doctor, right? Yeah. Well, so I'm a physician. My wife is a physician. They take care of our family. They take care of many of my patients. And so if probably don't show up now, but if you need primary care providers, they are outstanding primary care providers who have been in this community for some time. The last section that we had was who is at increased risk and how to protect. And I had that as a separate section. We've covered some of that, but I think it's worth going through again to talk maybe a little bit more specifically. So for the coronavirus, and it's called the novel coronavirus. It's called novel because our bodies have not seen it previously, unlike other sorts of viruses and coronaviruses, hence the novel coronavirus. The disease that it causes is COVID-19. COVID-19 is not the virus. The virus is the novel coronavirus. But for purposes of this conversation, the elderly or those who are at increased risk have been defined, as we said before, are 60 plus. The older you are, the higher your risk of mortality. Now that's real. So when we talk about really focusing on isolating or protecting our seniors, that's real. That's not a joke. It's not, he looks fine. It's not, child, she's okay. You can be a carrier and absolutely asymptomatic with this thing. You can be a carrier and never get sick with this thing. You can be a carrier and cause grandma or grandpa or aunt or uncle or parent to get sick with this and have a very different outcome than you will have. So that is very real. The statistics show that for those 80 and over, it's about a 15% mortality rate. Okay? On the flip side, it means 85% of even people over 80 will survive this, but 15% will not. So that's very real. Not only the elderly, though, are at risk, are those with underlying conditions. And correct me if I don't hit all the right underlying conditions, guys, but hypertension, heart disease, asthma, COPD, chronic obstructive pulmonary disease, other chronic lung diseases, hepatitis B, other reasons for being immunocompromised like HIV, chemotherapy, certain biologic medicines like Humira and Orencia. There's a whole list out there. If you have a question, check with your primary care provider. Some of the newer biologics that are out there to treat arthritis and to treat other diseases can lower your immunity. So it's important to understand that, particularly the hepatitis treatments. But if you're on any of those lists, take no risk with any unnecessary exposure. Very, very, very important. Diabetes, I'm sorry, yes.
If you're taking glucocorticoids as well.
Right, so if you're taking steroids and those patients, I'm so sorry, with diabetes, very important, because diabetics, for all intents and purposes, are immunocompromised and have a depressed immune system and ability to heal. And the other thing, as we learned today, is that young people can catch this disease. You saw these young people, some of you may have seen them down in Florida at spring break, feeling invincible. 70,000 of them last week in a stadium in Mexico at a concert. Today, a 12-year-old died in Los Angeles. Okay? So young people are not immune. My children believe they are immune. They are not happy that they are locked down in their homes, having to text their friends and however else they communicate. But it's out of concern for them and concern for their exposure to potentially infect their parents. That they're also kind of locked in at home. Know that your healthcare providers, we take precautions because we want to be available to the community. A lot of providers have closed their offices and said, you guys sort it out. The three of us, we continue to see patients and continue to be engaged. We also offer telemedicine, so if there's an interest and maybe you have a concern coming to the office or can't get to the office or just want to be safe or you're in one of those risk groups but you need care, we have the opportunity to talk to you face-to-face via secure telehealth platforms where we can have the conversation. That conversation's added to your medical record, and now probably 30 to 40% of my patients now are choosing that option. So you can schedule a telemedicine appointment with some of your physicians. With the three of us, I know you can do it, and you can check with your primary care doctor as well. And I think that was most of what we had, Archbishop, but if there are questions or other thoughts or concerns, we'd be happy to answer them.
Oh, one thing I want to mention, we're probably not displaying the best idea of social distancing here, but this is for TV. So.
Right. This is for TV purposes.
Is lupus part of that situation in terms of the immunity?
Yes. Yep.
Now, there's been some talk regarding certain medications being used that can assist, and some of those medications are actually lupus medications that have been used against malaria and other things, I guess, going. Are there treatments that we know of that can assist in any capacity?
Well, you good? Okay. So our president has incorrectly and irresponsibly put out some information about one of the drugs. I'll get back to that. Someone died today listening to him, saw the name of that drug in medication for their koi fish. The husband and wife took the medication. The husband died. The wife's in intensive care. They were able to interview her, and she said, well, that's what the president said to take, so we saw it on the bottle, so we took it. Hydrochloroquine is a drug that's used to treat malaria. Hydrochloroquine with another drug, azithromycin or Zithromax, some of you may have taken a Z-Pack. There's been a very small study out of France with 30 patients indicating that combination of drugs may shorten the severity, shorten the time that you're sick and shorten the severity of the symptoms. Is a very small study, not highly scientific. A friend who is a pharmacist in New York City called me to tell me that the government took all of his hydrochloroquine because they want to do a large study on that drug. It is irresponsible for people to try to take it because there are patients who need it because they're traveling in places that are endemic with malaria or for other disease processes. But that is, those are two drugs that are currently being studied to try to lessen the severity of symptoms.
There are actually several studies that are ongoing, and obviously those studies are going to take some time to really determine whether they are considered for treatment. But there are several arms of studies of different drugs to sort of treat this illness.
Also know that Connecticut so far has been pretty good. We are up a little bit over 200 cases in Connecticut. 2/3 of those cases are within 3 towns in southern Connecticut, which we obviously pray for those folks. But fortunately, because those towns are commuter to New York, Westport, one party in Westport had 50 people. Those 50 people spread as far as South Africa. They brought the disease. But Westport, Stamford, Greenwich, southern Connecticut has about 2/3 of the cases. Many of the towns in this area are in the 1 to 5 case range, and some towns have 0. We expect that will change. I serve on the board of the University of Connecticut Health Center, the hospital, and I can tell you that the hospitals here are working hard to be ready for what we expect will be an increase of cases. We don't have enough yet, but they're working to get more. And so part of that is when the governor says social distance, the governor says stay in after 8 o'clock, the governor says no gatherings. It's important because if it comes through this community, even though we're blessed to have several hospitals, they are not several really large hospitals, and we could overwhelm our health system very quickly.
There is a lot of talk regarding.
There's a question there.
There's a question down here. Yes. There is no cure, period, currently. All we do is treat it, and we treat the symptoms. And we hope that your body, in addition to the other things that we may give you, will overcome this disease and not succumb to the disease. But currently, to my knowledge, there is no cure. They're working on vaccines, which will be 12 to 18 months, at least. This drug trial which I'm very hopeful this drug trial shows promise, because hydrochloroquine is a very inexpensive drug, and Zithromax has a generic form, because sometimes, as you know, not everyone has health insurance in this community. Not everyone has access to drugs in this community. Not everyone has access to good care in this community. I also serve on the board of the Connecticut Health Foundation, which is a large $150 million organization faced on the problems of poor people and accessing care in Connecticut. And it's tragic what happens in this state. So I'm really hopeful, because at least these drugs could be accessible to people and not very expensive biologics, or an opportunity for pharmaceutical companies to profiteer. But currently, there is no cure.
There's also some studies, discussion at this point of trying to develop some sort of an antibody, which would be more of a short-term help, I guess, for people who have been diagnosed with it and who have developed their own antibodies. So there's been some discussion with, trying to develop that as well.
That'd be great. That would be a shorter term.
Right.
Essentially, if you got the disease and were a carrier and say were asymptomatic, or you overcame it, your body has developed an immunity, has developed antibodies. So the thought was you could take those antibodies and potentially share them with someone else to help boost their immunity.
Rudy, and then Dr. Young. Rudy? Stand on your feet, Rudy.
I was looking at TV, and it said that problem with your gastrointestinal system and diarrhea are also symptoms of this problem. Is that correct?
Yes, it can be.
Yep.
It can be.
That's a more of a newer
They
symptom.
couldn't hear him.
Sorry. The question was, could there be problems with your GI system with this virus? And that's one of the newer symptoms, where people can have diarrhea and GI distress. There was one that came out this morning, losing smell and taste, also as a potential symptom. And they said if you lose smell or taste and have none of the other symptoms, you should isolate or quarantine yourself for 7 days.
Dr. Young.
There are alcohol products on shelves that are only 40% rubbing alcohol. That's not sufficient for what you're saying.
Correct. Alcohol, right.
You need to be aware that just because it says alcohol, they've got the right product.
Absolutely. Thank you for that. Rubbing alcohol or things below 60% alcohol are inadequate. 60% is the number.
There's another questioning regarding how many people die from the flu every year, and compare the flu to this. Can you give a little more details of why that might be a bit ridiculous, or?
And so, as far as what?
Well, we're doing right now, we're quarantining people, we're isolating people because, this virus, but folk get the flu and die from that every year. So why not do it? Why do this so much?
Say it's no big deal.
Yeah.
Deaths that are occurring.
I think that the coronavirus has definitely, similar to the flu, there are very, very high contagious viruses. And the death rate, when you compare the influenza versus the coronavirus, the death rate is definitely a lot higher for coronavirus. And as Dr. Alleyne said, it is a novel virus, so we don't know how it's going to react. We don't know how, what's going to happen. I mean, it's been replicating doubling almost every couple of days since the last few weeks. So I think that when you look at the percentages of, yes, there's a lot of people who die annually from the influenza, but like I said, the contagion and the death rate is definitely a lot higher in coronavirus, and this is new, and we just don't know how it's going to react.
I believe in some studies that the death rate is 10 times. Usually, the general flu, the seasonal flu, is about 0.2%, right? And this is between 1 to 2%.
Yeah, in some areas, it's even up to 5%.
Mortality rate. So that's why it's a big deal, because if you get it, your chances of dying are 10 times higher than the seasonal flu.
For someone who has had stem cell transfer and chemotherapy in the last 3 years, what can they do to protect themselves?
Social isolation.
That's when
Yeah.
social isolation, quarantine, just the universal precautions. But if they're asymptomatic, contact their doctor to get further guidance, but doing all the universal precautions, quarantining, things like that.
Yeah, I think, the first thing you're going to want to do is to contact your physician or your oncologist to understand what the status is of your immune system currently. You had a stem cell transplant and other treatments. Is your immune system normal or is it still depressed? But someone who's had those treatments should be absolutely much more aware and trying to isolate themselves as best possible. The other thing we didn't talk about is the sort of personal protective equipment that patients and physicians will sometimes use, things like masks and gloves. Generally, I don't believe, unless you're in a big crowd of people, that everyone needs to walk around with a mask and gloves. People do. I have my own patients come to the office and do. I don't fault you. Most people don't know how to put the mask on correctly. Most people don't know how to use the gloves correctly. They think because they have gloves, they're protected, so they're touching everything. And then they go in their vehicle and they're touching everything. And then they throw off their gloves and they go and drive their car, which now their car has been infected with everything that they had on their gloves. So if you're going to use gloves, and that's a whole separate conversation that we'd be happy to have, but there's a certain way to utilize gloves such that they're actually helpful, not harmful. I see people using gloves and touching their face. I see people using gloves and eating food. I saw someone the other day, and he got highly offended that I pointed out to him that maybe he shouldn't eat food with his gloves. Go ahead, my brother. That sort of personal protective equipment, people are hoarding it. Also, right now, your healthcare providers need access to that stuff. Connecticut is woefully inadequate. New York is very inadequate in terms of the numbers of those things. So if you have them, it's great. And certainly if you're going to be in a crowd, I think going to the grocery store, or if you're going to be in crowded situations, particularly the mask, can be helpful, particularly those people who have some of the disease processes that we discussed or at the appropriate age. But it's something to be aware of. Coronaviruses have been around a long time. That's the common flu, is a coronavirus. This is a novel coronavirus thought to have started in an animal and made it into humans. So our immune system has not seen it. We don't know how to deal with it. Our bodies don't know how to deal with it. So a lot of the treatments that we're doing now is kind of guesswork based on our research and treatments of other coronaviruses. So you're absolutely right. This is a new coronavirus, a novel coronavirus. Probably started in China. Your president likes to call it the Chinese virus because he likes to divide. I don't know. It's here now, so it's an American virus right now. But yes, it's similar to other coronaviruses.
Stand up, please. Stand up.
Do you think that wearing a mask is beneficial? Any kind of mask, or are there certain types of masks that you can wear that would prevent the virus?
Well, there are some masks that are considered, that with N95, N99 masks that are considered to reduce the risk. I mean, nothing is 100%. So walking around with the mask, like Dr. Alleyne said, is a challenge because there are such shortages of PPEs or protective gear. Wearing a regular mask, which you probably see a lot of people walking around with masks, I mean, that's really not going to also help to prevent developing or inhaling any sort of respiratory aerosols of the virus. But it is shown that people who do have symptoms or cough symptoms should wear a mask, whether it is a N95 or just a regular mask, just to prevent the aerosol spray of a cough or a sneeze or something like that.
Yeah, I think it's more to protect the people around you
exactly.
than it is to protect you.
Exactly.
Right. And most people wear masks, like I said, don't wear them right. And really the only ones that are protective are the N95 masks, which are very difficult to get and in short supply. Dr. Collins and I were talking earlier, there have been some studies to show that these droplets can be aerosolized for up to an hour or two. One of the reasons that it's thought that it's spread through New York is that what does everyone in New York have to do almost every day is get in an elevator, right, to get up and down your building. So the fancy people who live 90 stories up, that's a long trip down with some coronavirus, which is why this virus does not respect your wallet. It does not respect your zip code. It affects everyone. But think about getting into an elevator. Someone could have sneezed on floor 20. You're getting on, and they got off on floor 18. You got on the elevator on floor 17. It's an empty elevator, but those droplets can still be in the air. If you have to get on elevators here, unfortunately we don't have to do it as much, but you go to the hospital, be conscious of how you push those buttons. Push them with your knuckles. Push whatever, get a pen, whatever you need to do, but be really conscious because everyone has touched that. Right, and I started thinking about it differently. I mean, how often do we get in elevators and we just push the button and don't think about what's happened in that elevator previously?
Subway, public transportation as well.
Yes, right, yeah.
Another question I had, what is the biggest myth with this novel virus that you've heard so far?
Biggest myth for me is that young people can't get it.
Right, that's true.
Right, and you got young people thinking that they can't get it. That's a huge myth. The other myth that circulates in our community, well, he don't look sick, right? Yeah, well, not with this one.
Now, as far as the disease goes in terms of sanitizing and disinfecting, how often should we cover surfaces and clean surfaces and disinfect surfaces and such? I mean, because even tonight, being in this room like we are, I would think it would be essential to make sure we wipe the seats down and everything else. We should be doing that how regularly?
After every use, if people are touching things, you got to clean them, and that needs to be in your kind of way of being inside your house. Right now, if everyone's been in the house and you've cleaned it and they've touched it, I mean, if you've cleaned it already, you're generally pretty good. But certainly with people coming in and out, my wife and I, we see patients. We change our clothes when we get into the house, and they go into a special hamper and that gets washed, because we don't want to bring that into the home. So if you're out in a large crowd, because this stuff can live on your clothes for hours, right? So if you're in a large crowd, you're at the store, you got to make that trip to Home Depot, Stop and Shop, come home if you can, and you have the ability, change your clothes.
One last question. This may be. You said something in regards to, drinking hot coffee or hot tea will wash down the virus in the throat. Can you apply the same thinking to the weather? When it gets hotter, do you think the COVID-19 is going to be destroyed by merely the heat?
Yeah, there's a lot of hope that that's the case. That hasn't been borne out yet. Even the temperature that a lot of hot beverages are more intense and more hot than the weather will change, right? If you're really getting a real hot cup. Tom Hanks and his wife, they got it, and it's summer in Australia where they got it, right? So one of the hopes is that because generally people will be outside more and windows will be opened more and there's more air circulation and folks may not be in close quarters, so that will be helpful with the change in weather, but not necessarily because of the change in temperature. I don't think that's really been figured out yet.
But I also wanted to add too that there has been some discussion that, like you said, maybe it would sort of have a lull in the summer, but then it would ramp back up again, is what they're predicting for the fall.
They're predicting that the fall it could come back.
Yeah.
So, in terms of this thing peaking, do you see an end to it anytime soon, or do you see a lull coming, or what are the thoughts, from the medical professionals? I'm looking at the numbers where they're growing each day, and with no vaccine in place, no medication in place, really, and a lot of folk not isolating themselves, I'm wondering when might a peak be coming?
My colleagues will have, I'm sure, some thoughts on this. I have very strong feelings about this because I believe the federal government has completely dropped the ball on this. We supposedly have the best health care in the world, right? We had a primary election that was fought about health care, yet other countries have handled this better than we have.
One of the things that we've heard in medical school is that you can't study what you don't measure. In this instance, you can't measure what you don't test. And so the inability to test the population accurately. I have a colleague who's a physician who's pregnant, who had an exposure, and she told me that she had to fight to get a test, and 5 days later she doesn't have the test results back. And she's a pregnant cancer surgeon who needs to be able to help patients who she's treating surgically for cancer, but had to fight to get a test, right? So the inability, so the concept of peak, we just don't know. We know that we're going to see increasing numbers of people get sick, for sure, but the ability to really understand how much this thing is permeated within the community is quite difficult if you're not testing.
Well, we want to thank these doctors for their time, and thank you for being present with us tonight and for fielding our question. Great question you did. And for those of you who are at home and you're in social isolation, remember you're never alone. The Lord Jesus says, "Lo, I'm with you always, even until the end of the age." With that in mind, God bless you. Have a good evening. Let's see you Sunday morning, God willing.
We encourage you to participate in giving by using Cash App with the handle $The First Cathedral 1. You may also use Givelify. If you choose, you may go to our website, www.thefirstcathedral.org, and click Give. You may also send your gifts through U.S. mail. Address your gift to The First Cathedral, P.O. Box 762, Bloomfield, Connecticut 06002. To give via text on your mobile device, text the word GIVE to 833-766-8657. Set up your account and enter your information. If you have a prayer request or would like someone to pray with you, please call us right now, 860-243-6520. We will join with you in prayer. God loves and values you. We are returning to the service, but feel free to leave us comments on our Facebook page. We are happy and excited to be worshiping with you. Once again, welcome to the First Cathedral.